Pinkslayer Patient Navigation Company. The principal function of the navigator is to eliminate any and all barriers to timely screening, diagnosis, treatment, and supportive care for each individual. Navigators act as the supportive hub for all aspects of patients' movement through the healthcare system. The navigator's role is to promote smoothly and timely continuity of care to the point of resolution. The chart you see here is Dr. Harold Freeman's patient navigation model he used in Harlem, New York. He recognized the mortality rate in lower income neighborhoods, which consisted of mostly African Americans, Hispanics, and undocumented people, was higher than Caucasians. His goal was to reduce the amount of mortality and increase the value of life through education. This chart gives you the visual mortality rate among various ethnic groups. Even though the data has decreased drastically over the years, the one item that remains the same is the higher mortality rate for African Americans. The main source of health disparities are low income status, social injustice, and culture. Let's say you have two women, one Caucasian, one African American. They both have 3 children. They both are single mothers, meaning they are the head of their household. They both have low-paying jobs with the same amount of bills. It's safe to say that they pretty much are equals. They both feel abnormalities in their breasts, in one of their breasts actually. They both are alarmed, rightfully so, and try to seek medical help to get an exam. However, when arranging the appointment to get seen, they both are required to pay a $50 copay, which will cause them both financial hardship. Now, here's where culture comes into play. The Caucasian woman takes her last $50 to pay the copay with the understanding if she doesn't, it could mean death and she will no longer be here to support her children. So she sacrifices, I guess, a few bills or groceries, however you want this story to go for you. And she goes to the doctor, which ultimately saves her life by getting diagnosed sooner. The African American mother decides not to use her last $50 for the copay because she don't want her children to go hungry. Although I understand her decision of putting her children's needs before her own, she didn't think about her condition being deadly in the long run, leaving her children without their mother. This slide represents the reason I started Pinkslayer Navigation Service to remove barriers that may cause patients to miss follow-up appointments or delay care. It is important for all patients to receive continuous care from the time of a suspicious finding straight through the diagnostics and treatment. All efforts should be made to ensure the patient obtains the best quality outcome. I was affected by over half of the barriers on this slide. I was diagnosed at the age of 37 after being laid off from my job. I was given the runaround when trying to sign up for medical assistance through state programs. I eventually went to the VA Medical Center in Hampton, Virginia, and was seen immediately. When I went to the intake worker and explained what was going on, she walked me over to the women's clinic, and from there I saw a physician this exact same day. She did diagnose acknowledge there was something abnormal. She scheduled the mammogram that same week. So within that same week, so far I've seen the intake worker who escorted me to the physician, who then made the mammogram appointment by the end of that week. So I went to have the mammogram done, and of course they saw the abnormality and explained that they would prefer me to get it removed. They in turn talked to my physician, and they scheduled the surgery, and I got the tumor removed with clear margins, which ultimately saved my life because everything was done within 2 weeks. From point of entry to exit, it was done. Although I still had to go through treatment, the actual tumor was removed within a 2-week time span of me contacting the VA Medical Center. Pink Slayer goals is basically to do what I just explained in the previous slide, was to help assist with timely diagnosis and treatment, provide information and education relating to treatment and cancer, preventative measures as far as your lifestyle, your diet, and different behaviors. And basically, the most important is satisfaction with the healthcare system experience. In the beginning, when I was trying to get diagnosed, I did not have that satisfaction on the civilian side because I was unable to actually get in to be seen. It was, it was very hard to figure out how to get seen. So I want to remove all the issues that I had in trying to get diagnosed, and help the next person who don't have the VA as an option, to where you can go there and get seen and get taken care of right away. Funding for Pink Slayer, because I'm not a big organization yet, although I am a corporation, a small corporation, I'm unable to acquire any grants at this time. My funding solely comes from things that I sell, like with the $5 jewelry and the skincare products. If I'm able, when I sell 50 pieces of jewelry or like 20 items of the skincare products, I'm able to take care of a family of 4 for a few days as far as groceries, or I'm able to get a few survivor bags, and in the survivor bags I have blankets, snacks, journals, books, everything you need during your chemo treatment. When you're actually going in to get chemo, you take your bag with you with everything you're going to need for that day. In most cases, chemo can last anywhere from a few minutes if you're just getting an injection to anywhere from 6 to 8 hours, depending on which treatment you're going through. So with being in a room for 8 hours with poison going into your veins, you're going to need snacks. You're going to need something to pass the time. And that's why I sell these items. And you're more than welcome to go onto the website to purchase these items to help me out. Not trying to plug it, but this is strategic communications. And hopefully for Christmas we'll be able to do a lot more for people that's fighting fighting cancer. This is the end of my presentation. I did want to leave you guys with a survivor story with this young lady. She was diagnosed young. This video is going to take me over my 10 minutes. So if you don't want to watch the whole thing right now, it's also on YouTube. But I am closing out my presentation with this video so you can see the importance of organizations like mine, Pink Slayer, Patient Navigation, and there are other organizations that you're going to hear about that's just as important as mine as far as the health and wellness of surviving cancer.
Now to that important medical news about early detection. Amy is taking a closer look As the third anniversary of her own breast cancer diagnosis approaches on Sunday, I cannot believe it's been 3 years.
I know, it really is incredible how time flies. Sunday, actually, is my 3-year anniversary of the day I was diagnosed with breast cancer, all because this woman right here, Robin, urged me to get my first mammogram at age 40. But women younger than me are hearing those same words, and for so many, early detection can be life-saving.
I feel free when I'm dancing. I feel like it's my safe place.
For Olivia Hutcherson, there's nothing quite like taking center stage.
Everyone talks about Beyonce and her Sasha Fierce. When I get on stage, it's like other Olivia comes out.
Other Olivia.
Other Olivia. I need to come up with a cooler name than that, though.
But on the night of her 26th birthday, at the height of her career as a professional dancer, Olivia's life took an unprecedented turn.
I remember looking down at the end of the night, seeing blood on the inside of my blouse. The following day, I went into the doctor's office. They told me that it was nothing to worry about, but I felt like something was wrong. I went back to the doctor just 3 days later, and I requested a mammogram. And
You requested a mammogram.
I requested a mammogram. They didn't want to give it initially because